So you have received your Clinical Solutions, or it's on its way. Clinical Solutions Retinol kit, and I decided I want to do a quick video because it comes with a lot of information, but reading is kind of annoying. So I figured it'd be better. How about I do the reading, and I'm gonna pass the info on to you. All right, so you got your amazing retinol 5% retinol set, and it comes in this awesome box, just like this. When you open your set, you are going to find this. It's a folded up piece of paper, and this has a lot of information on the product, on the Clinical Solutions Retinol and the facial milk. So when you first pull this out, there is a lot of information on there. If you are up for reading it, definitely go for it. There's some post-retinization protocol. Or if you already have used retinol before, there's some protocol for those. Then the next thing that you're going to pull out of your box is your retinol packet. So this is Amplify Your Aging with the Clinical Retinol Set. And you're going to open it and it's going to tell you all about the products that you have. So on the first page, it tells you the set, why it's effective. Just a little FYI on what retinol is. It is a vitamin A derivative, and it actually stimulates the surface skin cells to renew the appearance, to make it look more like it did when you were younger. It supports natural collagen production in the middle of your dermis, so the middle layers of your skin. You have many layers of skin. So it actually penetrates deep to those middle layers to actually repair your skin, to help produce that natural collagen that as we age, we tend to lose. And it's going to help improve elastin. And when you are improving collagen, it's actually going to deplete it's going to help your skin look younger, just, like we want. So this is going to prevent the signs of aging if you have not aged where you can see it yet. And it also is going to reverse signs. So that's what I love about this product, is it actually reverses and prevents. Anybody, men or women, age 20 and up, can use this product. It is amazing. I do always suggest, if you are going to use the retinol, or I don't suggest, Mary Kay suggests, if you're going to use the retinol, use the facial milk, but the facial milk can be used on its own. So that just kind of gives you some little information so you know. And then this back page is your retinization journal. So this is so you can keep track of when you use your facial milk and your retinol. So then that way you can kind of just kind of know what you're doing. So as you see, the first week we will talk about week 1 and week 2. It even says once per week on the same night, diluted with Calm Restore facial milk. And what it means by that, once per week on the same night. So if the first time you use it is on a Tuesday, use it the following week on a Tuesday. And then that way you know for sure there is a week between it, because your retinol, you definitely need to do it step by step. Okay, we are going to go over some quick tips. So before you apply your retinol, you want to cleanse your face. So we're going to wait 5 to 10 minutes after cleansing your face before you apply your retinol solutions, because we want to apply this to dry skin, but we want to apply it to clean, dry skin. The reason we need it to dry is because we want the skin's natural oils to return to the surface of the skin, because this will actually help reduce any discomfort the retinol may cause you. It's also important to note that after your skin has been retinized, it's still recommended that you wait 5 to 10 minutes. Okay. Retinol may contribute to sun sensitivity. So when you are using this product, make sure that you are using your SPF 50 or more each morning. So I know if I have sold you this, I know what you're using for skincare, because you're probably using Mary Kay. And so I know you're using your day cream from the Miracle Set, or your Time-Wise Repair day cream. Or we've talked about a better day cream, or SPF to use in replacement of those. But your skin is going to be super sensitive, so you want to make sure you're always using your sunscreen. How much you need? A little goes a long way. 1 pump. It's a pea-sized amount, just 1 pump, and that covers your entire face. And when you go to apply it, and don't use more than that because it'll cause irritation. When you go to apply it, you want to put it on your forehead, your chin, and your cheeks, and then maybe on your nose, and then that's how you want to apply it to the rest of your face. Avoid your eye area. These should not be, the retinol should not be close to your eye area because the skin around here is different than the rest of your face. So after you wash, you want to go ahead and put on your eye cream, and then you want to put on your retinol. So step 1, wash your face, let it dry, then put on your eye cream. The reason for that is we don't want you to put the retinol on and then you go and you're putting on your eye cream and you accidentally get that retinol too close to your eyes because it will irritate your eyes. Also, during the retinization process, these first 8 weeks, avoid using any exfoliators, high concentrations of vitamin C, which kind of include exfoliators is, you know, the microdermabrasion. That would be, I'm actually going to go through the catalog. The charcoal mask, avoid using the charcoal mask because that's an exfoliator. The facial hydration, Radiance facial peel, avoid using that. Also avoid using a skincare brush during this process because your skin is going to be sensitive and we don't want to overstimulate it. So any type of exfoliator. If you have a question on something, definitely always feel free to ask me if it would be a good idea to use it or not. High concentration of vitamin C. Serum plus C, serum C plus E. Let's avoid using that for right now until you are through the retinization process. Also, if you have the activating squares, avoid using those. Also, avoid using hydrogel eye patches and any acne treatment products. So the one skincare set that this Clinical Solutions cannot be paired with is any acne fighting products. So if you do use an acne treatment of some sort, just avoid using that. I think you'll see that once you start using this, you might be able to avoid acne treatment products altogether because retinol actually, you can get prescriptions of it to help improve acne, so which is awesome. So after you complete the retinization process, you can slowly start to introduce those things back into your skincare regimen. But we just want to take away any extra irritation for right now. And that way we know that if you are getting irritated, your skin, it is because of the retinol. So we're just going to scale back on any of those right now until we get through this retinization process. So when you first begin a high concentrating retinol, like retinol 0.5, your skin will need to go through this adjustment period. So during this period, your skin slowly builds up a tolerance to this retinol. So Mary Kay has actually designed an 8-week process to minimize potential discomfort from dryness, temporary redness that may occur while using this product. First-time users, it is recommended that you complete this 8-week retinization protocol. Sensitive skin, if you have sensitive skin, it is recommended that retinol is more slowly introduced to your skincare routine, scaling back frequently if you have any skincare discomfort. So let's say you do week 1 and 2 where you're diluting the retinol with the facial milk, and you go to week 4 where you're putting the retinol on 100% and then following it with the facial milk. If in week 3, let's say, just putting it directly on your skin gives you discomfort, go ahead and do another round of the week 1-2 treatment where you're actually squirting the retinol into your hand, and then you're squirting the facial milk and you're mixing it and then doing that. Give yourself an extra week, and then see if you can't, go up to that next step, which is 1 time per week on the same night, followed by the Calm Restore facial milk. Sorry if it looks like I have notes up here, so I'm making sure I get through everything. Results take time. Be patient. These clinical solutions, use them as directed. If you use more, it's not going to give you better results. It'll just possibly irritate your skin more. There is never a need to use more than one pump for your entire face. Remember that clinical solution prevents and reverses the visible signs of aging. If you don't yet have visible signs of aging, you're not going to see a big change in your skin as if you were using the products to reverse signs of aging. So temporary discomforts that you might notice is maybe a little bit of redness, dryness, flaky skin. These are common temporary skin discomforts, and they're often associated with first-time retinol use, especially during this retinalization period. Some users also report maybe itchiness or mild tingling. Some of these symptoms at some point during the retinization period. So, and other people have had no side effects at all. I actually have a good friend that used it that said she did feel she said it was a mild tingling. She said I would almost say she would describe it as a burn, but she's like, it started to kind of, when she said it was, she's like, it kind of like had this slight, burning sensation. She was like, she goes in, I guess it would be more of a tingle. She said an intense tingle is what she said, but it started to subside. So if it gets worse, that's a problem. If it tingles intensely, but then starts to go away, then you're okay. So if skin becomes uncomfortable, scale back on the frequency of the application until your skin tolerance has improved. So the facial milk can be applied throughout the day to relieve any type of skin discomfort. So you go ahead and you take this facial milk with you, and you can actually apply it over the top of your makeup. So if you're having some discomfort right here, just kind of apply some of that facial milk right over the top of it. This is your best friend during the retinization process, is this facial milk. If you have an upcoming medical procedure, discontinue the use of retinol at least 1 week before your medical procedure. That includes any laser treatments, chemical peels, or any other surgery, whether it be medical or dental, that require general anesthesia. Also, if you have an appointment for a facial waxing or like lip or eyebrow, discontinue the use at least 3 days before. So let's say you, and that's if you are using it every single day. But if you're on this first period of retinization process, I would kind of avoid that. So this is talking about discontinue use after you're through this retinization process. If you have a waxing coming up and you just started the retinization process, I would almost cancel your waxing. I would maybe cancel the wax because that is an exfoliation and that may possibly irritate your skin. So like I said, dispense when you are using it 5 to 10 minutes after cleansing. Put on your eye cream and then dispense a pea-sized amount onto your fingertips, which is 1 pump of this product. Then dot it onto your forehead, your nose, chin, and each cheek, and distribute the product evenly upward across the face, avoiding the eye area. So this product is really exciting because it is one of its kind. It is called Dermocosmetics. So dermocosmetics means, well, I'm just going to read it. Is a term used to describe products as an intersection of cosmetic beauty and skin health. Dermocosmetic products are similar to formulas you will find in a dermatologist's office or a medical spa. So you are getting the best retinol. These are products that you would find in a dermatologist's office or if you went to the medical spa to get them, because this product right here is the highest grade of retinol that you can get without a prescription, and you are able to get it right in your own home. First thing I'm going to have you do is snap a picture, because I want to see your picture right now, and then I want to see your picture at 4 weeks and possibly at 8 weeks, and then maybe let's do a 12-week one. So that way we have a whole journey of your retinization process and you can see your results. So that way at 8 weeks when you're done, you are going to see what it has done for your skin. I am really jealous because when I received my clinical solutions from Mary Kay to try, I was actually pregnant. So that is one good thing to know. If you are pregnant, planning to become pregnant, or currently nursing, you cannot use the retinol solutions. So if you are any of those and I sold this to you, you give me a call because we are going to have to wait until you're done with those before you try this product. So I'm really excited to see your results from it and everything. And please keep in touch with me. I'm going to keep in touch with you, and I'm going to call and check up on your skin. If you have any irritations or anything that is worrisome, definitely feel free to call me at any time. I would love just to kind of, to talk with you about it, because this is a learning process for me as well, because you're one of my first customers to try this product. So look forward to seeing your results, and can't wait to talk to you soon.